Mom, Dad, you should know how to prevent choking episodes from happening in your young child. And you should also know what to do in case of an emergency. According to the American Academy of Pediatrics, choking is the leading cause of morbidity and mortality in children, especially those who are less than 3 years of age. Foods, coins, and toys are the leading causes of choking-related injuries and death. In this video, we will talk about what is choking, is it an emergency, what first aid you can do, what to do in case of a choking episode in your child, and how to prevent it. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. What is choking? Well, if your child is choking, it usually means an object, most commonly food or toy, is stuck in his or her trachea, which is the airway. The air does not flow normally in and out of the lungs, wherein the child cannot breathe properly. Most of the time, the food or the toy only partially blocks the trachea, and it is coughed up and breathing returns normally. If the child seems to be choking and then has coughed it up, but is later breathing normally and talking okay, then the child usually recovers without any help. When is it an emergency? So sometimes the object gets into the trachea and completely blocks the airway. The airflow in and out of the lungs is completely blocked, which can lead to the brain being deprived of oxygen. At this time, choking can become a life-threatening emergency. It is an emergency and your child needs help right away if the child cannot breathe, the child is gasping, or if you hear wheezing, if the child cannot talk, cannot cry, or cannot make any noise, if the child turns blue, if the child grabs at his or her throat or waves his or her arms, if the child appears panicked, or if the child is limp or unconscious. If you have been trained in emergency care, at this time, you can do abdominal thrusts, or also known as the Heimlich maneuver. The first aid for choking. If you have kids, it is important to be trained in the CPR or the cardiopulmonary resuscitation, and also training in abdominal thrusts or the Heimlich maneuver. Even if you don't have kids, knowing how to perform these first aid procedures can let you help somebody in need. So the training of abdominal thrusts and CPR are part of the basic first aid courses. Now, what happens when the abdominal thrust or the Heimlich maneuver is performed? Well, a burst of air is forced up from the diaphragm up the trachea that would dislodge the foreign body. The technique appears simple, but it should be done with caution. What to do if you see your child choking? Let's discuss some possible scenarios. If you see that your child is choking and coughing, but can breathe and can talk, in this case, the airway is not completely blocked. It is best that you do nothing. Just watch your child until he or she recovers completely. Most likely, your child will be fine after a coughing spell. It is best that you remain calm and stay with the child until he or she completely recovers. What to do in this scenario? If your child is choking and is conscious, but is not breathing, not talking, not making any noise, or is turning blue, this is the time to perform abdominal thrusts or the Heimlich maneuver and call 911 or have somebody else call 911. If you have been trained to do so, begin the abdominal thrust or Heimlich maneuver. If you haven't been trained and nobody else is available, wait for help to arrive. What to do If your child was choking but is now unconscious and not breathing, well, shout for help and call 911. If you have been trained to do so, start CPR immediately. If you haven't been trained, wait until help arrives. If your child is choking, when should you call the doctor? Or when to bring your child to the ER? And what are some ways that you can do to prevent choking episodes from happening? Well, before we go to that, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding your baby, when you know how to soothe a crying fuzzy baby, when you know when to worry and call the doctor, when you can understand your baby's sleep schedule and you can better take care of yourself as well, when you get to know and learn more about postpartum depression. How much better life can be when you can get the training in the comfort of your own home. Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. What to do? You need to bring your child to the ER for any choking episode that would require medical care. If your child has had a lasting cough, if your child is drooling or gagging, if you hear any wheezing, if your child has trouble swallowing or has trouble breathing, if your child has turned blue, limp, or was unconscious, even if it seemed that your child has recovered, if you think your child has swallowed a button battery or multiple magnets. Also, for any choking episode but the child has fully recovered, you do not need to bring your child to the ER, but you need to call your doctor. How to prevent choking? Well, all kids are at risk for choking, but especially those who are 3 years and younger. This is because at this age, kids tend to put things into their mouth, have smaller airways which are easily blocked, and they don't have much experience about chewing. To protect your child, try to avoid these choking hazards, which are hot dogs, nuts and seeds, popcorn, pretzel, potato chips, chunks of peanut butter, chunks of meat or chunks of cheese, hard, gooey, sticky candy, whole grapes, raisins, raw vegetables, and chewing gum. How else to prevent choking? During mealtime, serve small bites to your child. For whole grapes, for example, cut them into small quarters. For hot dogs, cut them lengthwise and into smaller pieces. It is better if you cook vegetables instead of serving them raw. Then, teach your child to sit down during all meals for all snacks as well. Do not allow them to talk or to laugh with food in their mouth. And stop your child from running around with food in their mouth. How else to prevent choking? Well, toys and other household items can be choking hazards. Remove the following from your home, such as inflated or broken balloons, button-type batteries, pins, coins, marbles, tiny balls, and pen caps. Keep small objects away from your child's little hands. Other ways to prevent choking? Well, you should choose safe and age-appropriate toys for your child. Always follow the manufacturer's recommendations. Remember, choking can be prevented. And now that you know, you need to take time to come prepared. CPR and other first aid courses are available to you. And how about you share it to 3 of your friends who might benefit from this video. And if you like this video, watch my next video where I teach you about other child health problems.